Good morning, everyone, and thank you so much for joining us for day two of this awesome Living Well Faith, Health, and Wellness seminar, which is hosted by Care Incorporated in collaboration with FIU. It is indeed our pleasure to have with us this morning Dr. Holder, Dr. Staples, and students from the FIU Oncology Interest Group. Now, before I go any further, I want to introduce to you our main presenters, Dr. Holder. Dr. Holder, you could just use the opportunity to introduce yourself to the audience.
Good morning, Reverend Stewart. It's been a long time since I've been able to connect with you since this pandemic, but I look forward to coming back out. And to all of Miami Gardens, good morning.
Good morning, everyone. It's a pleasure to be here, and I look forward to having this very important discussion with everyone, and thank you for having me.
We're now going to be asking Styler from FIU Oncology Interest Group to introduce himself to the audience.
Hi, everyone. Thank you for having us today, Care Incorporated. We are honored to be here, and we look forward to a great session with you all. So thank you again.
Wonderful. Thank you. Oreo, could you please introduce yourself?
Good morning, everyone. It's a pleasure to meet you all, and I look forward to learning and conversing with you guys about the different important topics we have today.
Thank you. And of course, Anais, also from the FIU Oncology Interest Group. Please introduce yourself.
Good morning, everyone. Very excited to be here, very excited to give you the brief presentation we've prepared for you. Again, it's an honor to be sharing all of this with you. Thank you.
Taking the time to be with us this morning. As we know, we are located in the center of Miami Gardens. Miami Gardens being one of the largest predominantly African-American city in the state of Florida. Now, we recognize that when we talk about health disparities, the conversation may look different for different minority groups. Today, what we will be exploring is pretty much what is the Sorry about that. We're just going to be exploring health disparity among African Americans and Afro-Caribbeans. So without any further ado, I'm going to be turning over to the FIU Oncology Group to do their presentation in regards particularly to this minority group. Thank you so much.
All right, so I'm going to go ahead and share my screen. All right, can you see that all right? So thank you all again for being here today. We're just going to give a brief presentation, and if you take anything away from this, we just want you to know that screening is important. If you get screened early, that prevents worse outcomes later, and prevention is greater than treatment. So here's a brief overview of what we'll be running through today. And now I'll let Anais introduce herself once again.
Hello, everyone. Thank you again for having us here today. We're really excited to present to you all of this information, which we find to be really important. Just to give you a little background, I'm a second-year medical student at FIU, and I have a really strong interest in the field of oncology because my family has been impacted by it, and so this has really inspired me to explore more of the field. And I'll go ahead and allow Sky to introduce himself now.
also interested in the field of oncology for family matters. And I think this is a great time to talk about screenings, as is always. And I'm a big fan of cooking and exploring Miami in my free time. So, Ore, take it away.
Good morning. My name is Ore Lua Oloran, but most people just call me Ore. I'm a first-year medical student, and I've been interested in oncology for a long time, having done research in my undergrad. And in my spare time, I really enjoy exploring the food scene in Miami. I don't think I've had food anywhere else that's nearly as good.
Why do why are we talking about screening today, and why does this matter? Well, across the board, African Americans typically have worse cancer outcomes as compared to their age-matched counterparts. And a large reason for this might be the lack of screening in this population. And so in this figure, I've just highlighted one segment, and you can see that the African American population has a greater incidence of deaths, and largely in part, again, because of the significantly reduced screenings. So cancer screening can save your life. It all starts with screening. If you check out the Miami-Dade Matters website, you can find a bunch of resources and information about the Miami Gardens community as well as other communities in Miami. And if you look, it shows that there's less colorectal cancer screenings among the Miami Gardens population as compared to the national average. So if we are to increase our cancer screenings among the African American population, we may be able to address cancers earlier and prevent detrimental outcomes later. And once again, prevention is greater than treatment. Ore?
To discuss the importance of family history. Um, One of the things that I want to start with is just talking about what a family history actually is. As you can see from the slide in the presentation, a family history is a list of the diseases or conditions that your immediate family members may have experienced. And this is a useful diagnostic tool because there are some diseases that have a genetic or inheritable component, which means that if your father or your grandfather or your mom or your aunt had it, there's a chance that you will get it as well. And for your physician and for your healthcare team, it is very informative to know what to be on the lookout for, so to speak. So we have a case study here. There's a young man, I believe, Tom Marquez, who his father and his grandfather both had his father and his grandfather both had colon cancer. And because he informed his physician of this family history and was able to bring it to their attention, they recommended that he get screenings a little earlier than most people would. So just to summarize that, family history is important because it promotes preventative screenings ahead of time, and it gives the opportunity to minimize disparities as much as possible by detecting and catching any sort of risk factors earlier than they otherwise would be.
So, as already mentioned in the last slide, some cancers can be prevented. And when you talk about the words prevention and screening, I really do believe that they go hand in hand. This may come as a surprise, or it might be something that you may know already. But for example, cancers of the colon, of the rectum, and of the cervix can be prevented through screening. To explain this a little bit further, when you get a screening and there might be a lesion that they find, they can treat it. And this lesion may have had the potential to become cancerous, but because it was treated early, we've avoided all of that. So that's why it's so important. Another reason why it is really important is because cancers can be detected early. Typically, when you detect cancers earlier, the treatment will be a lot less aggressive than if it was an advanced stage, and the outcomes will be a lot better because the person is less sick. So the road to recovery and back to health will hopefully be a lot quicker and less exhaustive. Below are some of the available screenings that are typically done. For example, these include breast cancer, cervical cancer, colorectal cancer, prostate cancer, and lung cancer. And if we go to the next slide, these are some of the community resources available in order to explore more of the screenings that may be available to you. And we posted Dr. Holder as our first choice because she's so involved in the community and so knowledgeable. So always a great point of contact. And we've also included some others, like for example, the Green Family Foundation and Health Program, and the Mammogram. And below are some others. And we just want to really emphasize that these screenings are typically outpatients, which means that you'll be in and out. They're short, they may require some preparation in advance, which is typically not bad at all. And we just really want to signal how important and the benefits of having these screenings are. Always, always more beneficial when comparing maybe the discomfort of going to the doctor or something along those lines. So screenings really important and good to get them done.
So now we'll open the
And now,
floor for questions. And if we don't have any at this time, we can let the other present and circle back at the end. Thank you all for your time. And remember, prevention is better than treatment.
Thank you all so much.
thank you.
Thank you so much for that, Skylar, Oriel, and Anais. We are now going to be turning over to Dr. Cheryl Holder, who is who is an associate professor of FIU. She is also the intern associate dean for diversity, equity, inclusivity, and community initiatives. We're very excited to have you, Dr. Holder. You may now present. Thank you.
Okay, good morning again, and it's a pleasure. When Skylar said prevention is better than treatment, I was remembering back, I'm telling my age, so if you remember back to Kingston, Jamaica, because I know PenTab has a lot of Jamaicans in the congregation. If you remember back to the 60s, one of the bus tickets would say, prevention is better than cure. Hold the rails, you're safer for sure. And that message that the medical students gave brings me a lot to what makes you ill. So I'm going to share my screen and give you the presentation that I have. I'm going to show you some statistics and but really for you to think about a little bit more of what makes you ill, more than just going in and doing the things you have to do. And that's what we want you to do, how to help you get there. So am I sharing okay? You guys can see it pretty well? Lateya? Perfect. All right. So what we teach the medical students, which I want to give the community a little understanding, you get sick much more based on where you live, where you work, where you play, where you grow, the church you attend, and how you grow up in life. And then how much money do you have access to? What are the policies that are underlying what's making that how you live? What resources do you have? When you look at all those factors together, we see that those factors affect you even more than your genetics, your DNA, or what decisions you make. So when we look at health, we got to look at the entire community and say, what is it in Miami Gardens that can help make me stronger, make me healthier? Because when you look at some of the statistics, and we know how Miami Garden is big, it's 20 square miles, one of the biggest areas. We see a picture of the Hard Rock, and everybody used to think all Miami Gardens is the Hard Rock Stadium. But we know it's more than that, because I've been in Miami since Miami Gardens, working there at Health Center since the 1990s. And I remember when it was Carol City to grow into Miami Gardens. And some of the things we know about Miami Gardens, that it's not as rich as other parts of Florida and Dade County. And the insurance rate is only at 70%. So some of our access issues of be able to get those screenings often directly related to our insurance. And when we look at poverty, the average income in Miami Gardens is a little bit lower than most parts of the county, and with the poverty rates of about 21%. So we know, again, access to money, access to insurance impacts your health. How educated you are affects you, because through education, you can get better jobs. Also, it helps you get better choices in food choices. It helps you to adjust the diet that might be your cultural way of cooking, but with the more education on what you can do with that existing diet, you can tweak it so you can make it healthier. We also know that diseases like HIV, AIDS, and lung disease, and high blood pressure, and diabetes are much higher in our communities. Not simply because of genetics again, but because our access to be able to exercise. If you're working 2 jobs, which I know many of my patients, when I took care of them at North Dade Health Center, were working many hours. And many of their jobs didn't give them the ability to walk around and get a lot of exercise. And then they would come home tired. And when they came home tired, they're more likely to be what we call sedentary, not do as much physical activity because we're just tired. Then we look at blood pressure, the diet again, and not having ready access and not having the energy just to keep up with the illnesses makes your outcomes a lot worse. And Afro-Caribbean or African-American, the disparity in these diseases are significant. But one thing we do know is that it is still Miami Gardens, and I love to look at the strengths, because as I tell our students, when you go to Miami Gardens, I don't know any other municipality in South Florida where you can go on one end and get some of the best Jamaican patties, then you go down the block and get some incredible Ethiopian food, then you go around the corner, you get some Nigerian food, then you can get some Hispanic food, Chinese food, you go all over. There's nowhere else you can get that variety and that sort of energy in our communities. So it has become the epicenter of Black community. But there are policies that we do have to really consider. I love Live Healthy Miami Gardens, and I encourage everyone to go on this site. I'm going to see if it will come up, because this site tells us a lot more of what is happening in the Miami Gardens community and some of the steps that you're taking to change. I bring you to one area about health impact area. And this is very concerning for us, because when you look at the alcohol, tobacco, and drug section, and this is where we're going to think about how policies work. One thing we know in our communities, that the Black communities and poor communities are targeted by advertising. And when you look at how adherent and compliant are these industries and these stores, which are much more in not selling to young people, in not encouraging the bad habits that we see that many of the retail landscape here, 2/3 of Miami Gardens visited by decoy shoppers, were non-compliant with local and state laws. So there are a lot of things that we see that's happening in our communities that we know could be improved. But in general, Miami Gardens has, stopping sharing, so I hope I can come back. Okay. So that just gave you a quick synopsis of all the factors that we're seeing. But Miami Gardens has tremendous potential to be able to harness these resources, work with your politicians, work with programs like Live Healthy Miami, with the vibrant entrepreneurial communities. It's a relatively young community at about average age around 35, 36. So we know that together we can make those changes to those data that I showed of the high blood pressure, diabetes, HIV, all those complications that comes from living in communities that may not have all the resources that may not have all the access to the money and power that we would like, but such potential to make that difference. You just elected a new mayor, hold your mayor accountable. Hold your police officers accountable. Hold everyone accountable to making that environment more supportive of your health. Where you live, where you work, where you play, where you worship, where you love is what defines how well you will be. So as much as you work to change that environment, you then will be able to access that screening. You'll be able to have money to be able to buy your medications and change your food and stay in high school and get these kids educated and stay in college and stop merchants from selling alcohol to underage kids and push your merchants to have healthier options and push your restaurants to do what's right. So together as a community, you address these underlying factors, we will improve your health outcomes and it'll be seamless. Like I tell everyone who's been to Jamaica, my grandfather lived to 99 and he lived on top of a hill where he had fresh fruits and vegetables and he walked every day and he lived a long, full life. And he never got any screening because he never had that access to them. Maybe if he had, because he eventually died of cancer. However, we can make our society and our community support our health. So we can get those screenings, we can find out we have diabetes, we can make those changes, whether you're African American, Caribbean, or Hispanic. So live well, Miami Gardens, and I look forward to further questions. Thank you.
Wow, thank you so much, Dr. Holder. Excellent points that you have made just regarding the holding our community accountable and that just collectiveness in terms of we're not just responsible for our own health, but the health of our community as a whole. And we thank you for your role and the role that you're playing in educating our community and just informing us on the importance of just understanding the dynamic of when we talk about the health of Afro-Caribbean and African American. You have raised some excellent points, but we're not having a panel discussion. Those questions will be coming in at the end. So I'm going to be turning over to Dr. Shanae Samuel Staples, and she is the Health Policy Research Specialist at Florida Health Justice Project. So, Dr. Staples, I turn it over to you.
Yeah. So I'd like to echo what Dr. Holder said. I am also from Kingston, Jamaica, and I recall my grandparents living well into their 90s, and it definitely, I'll kind of delve into this a bit more in my discussion, but it definitely shows how our environment and the resources within our environment can affect our well-being. So I wanted to talk a bit more on the social determinants of health. Dr. Holder definitely did a great job delving into the different factors that affect one's health, particularly in terms of Miami Gardens. And just to reiterate, the social determinants of health are essentially the economic and social factors that influence our health. So they certainly play a role in the observed differences that we see. They play a role in health disparities, and it's important to know the different social determinants of health, to know the different factors that can influence your health outcomes. So essentially, in terms of the social determinants of health, there are 5 categories. And the first one that we typically think of when we think about things that affect our health are our actual health, so health status, as well as healthcare. So in terms of healthcare, that can include access to healthcare, which Dr. Holder mentioned previously. And there are actually 2 types of access to healthcare. So there's potential access, which is essentially the resources that would enable one to use medical care. So we think about things like whether or not someone has access to health insurance. And then there's a second type of access, which is realized access. And ultimately, that's our goal, right? We want to be able to use medical care when it's needed. So while health insurance coverage, which again is a type of potential access, does increase one's ability to use healthcare when needed, there are other factors that may present itself as a barrier to actually using care. So for instance, even if you're insured, you may be underinsured, meaning that you have a sufficiently large out-of-pocket cost. This is usually the case with high deductible plans, where you have to meet that deductible, let's say $2,500, before your coverage is able to kick in. Certainly that affects your ability to access needed healthcare, because if you do not have the funds to pay for a particular visit, then you may delay or even forego medical care altogether. Another factor is lack of transportation. So whether or not you have access to a personal vehicle. If you don't have access to a personal vehicle, are you able to gain access to adequate public transportation in your community? So that kind of brings me to the second category of the social determinants of health, which is your neighborhood, and we tend to call this your built environment. So some factors that may influence your health within your neighborhood includes whether or not you have access to healthy and affordable foods. For example, do you have a food market in your neighborhood? Again, is there adequate public transportation to get to and from places such as doctor visits? And also, are there safe parks? Are there community centers where community members can actually go and exercise, and your kids can go out and play and stay active? Things like that certainly affect your health and whether or not you have safe and affordable housing. And then the third category is the social environment. So the social environment includes things such as whether or not you have social support. So do you have a family unit? Do you have friends, your church peers, your coworkers who can help you to achieve particular goals that you have set for your health? So for instance, a perfect example, if you're wanting to quit tobacco, do you have the kind of support that's needed to successfully quit tobacco in the long run? And also we have to include in this category of social environment, which has been a topic that, unfortunately we've had to face within the past couple months, racism and discrimination. So this can also affect your health. There's actually something called the weathering hypothesis. And with this hypothesis, studies have tested this hypothesis and has actually found that constant stress and living in an unequal society and exposure to racism has actually been linked to early onset of chronic conditions. So for our population, this is something that's particularly unique. And think of it as, here in Florida, we get hurricanes very frequently. So think of a house that's constantly being battered by storms. It's the same effect where you experience excessive wear and tear over time. And that's this kind of same mechanism that we see in our bodies, is that it leads to early onset or may increase the chances of early onset of chronic conditions. Within this social environment, there's also policies and laws. So Dr. Holder mentioned this previously. She touched a bit on this, but I want you to think about things like state Medicaid expansion. We know that Florida is one of the states that has chosen not to adopt Medicaid expansion. And over 50% of people of color actually fall within that coverage gap, where without Medicaid expansion, they're unable to gain access to health insurance because their incomes are too low to actually qualify for tax credits under the Affordable Care Act, but their incomes are too high to qualify for Medicaid. So that certainly affects our population, because then you don't have access to health insurance, and then that creates a whole mechanism of, well, now I can't gain access to healthcare. The fourth category is economic stability. So, again, are you employed? Are you living below the federal poverty level? Are you food secure or housing secure, which means are you able to afford housing and food? These things affect your health as well. And then the final category is education, and education greatly influences some of the other factors that we talked about. It determines one's earning potential, which in turn influences whether or not you're able to meet certain needs such as housing, food, and healthcare. So those are essentially the 5 categories of the social determinants of health that may influence one's health. And even in terms of, I wanted to go back to policies, zoning and land use laws definitely play a role as well, because this impacts your access to healthy foods. So there's some research that has actually shown that lower income communities are less likely to permit things such as farmers market or community gardens, which has actually been shown to be an alternative in terms of low cost ways to increase access to healthy foods. So thinking back to Jamaica, many of us, if we grew up in the islands, we know that in our backyard, we often had a fruit tree or two where we could just go and gain access to, healthy foods, or break open a vegetable and, right there we have a fresh and healthy meal that we can prepare. So, zoning laws are definitely something that isn't talked about often, but it certainly affects your health. And, as community members, you want to ensure that your leaders in your community are also paying attention to what type of zoning and land use laws are within your community that would enable you to gain access to healthy foods. So in terms of what are the major health needs of African Americans and Afro-Caribbeans, we have access to care, which we discussed earlier. So of course, health insurance coverage. In terms of being in a state like Florida, where we have chosen not to adopt Medicaid expansion, this is definitely one of the major needs, because we know that people of color are greatly affected by the decision to not expand Medicaid. And studies have actually shown that Medicaid expansion does reduce health disparities, particularly among our populations. And then unique to the issue, unique to Afro-Caribbeans is the issue of immigration status and accessing healthcare. So we know that, undocumented immigrants can receive low-cost care through federally qualified health centers, but primarily this is preventive and primary care, which is important. But if you're diagnosed with a condition that requires that you see specialists, how then do you pay for your specialist visits to properly manage your chronic health conditions such as diabetes? So that's certainly a major healthcare issue that we have among our population. And then also, access to affordable and reliable public transportation. And one of the ways that we can alleviate this, again, is through collaborating with urban planning in our communities to make sure that we have an adequate public transportation system. And then also ensuring that health insurance companies cover telehealth visits. So during the era of COVID, this has become, a great alternate in terms of being able to see a doctor without having to show up for your doctor's visit. And that may be an alternative that, past COVID-19, we can continue to use that for certain visits that do not necessarily require that you're physically present in your doctor's office. And the last kind of major issue that I'll mention that I don't believe is talked about enough but it has gained some traction during COVID-19, is having access to paid sick leave. So Blacks are disproportionately represented in low-income jobs, and we're most likely to lack access to paid sick leave. And studies have shown that access to paid sick leave increases cancer screenings, which medical students talked about earlier in terms of its importance. So this is another major issue that we definitely need to address among our population is to ensure that we have access to paid sick leave so that we can see a doctor whenever necessary. And I don't want to take up too much more of the time because I do know that we'll have a discussion after this. But those are kind of like the major topics that I wanted to touch on, just to go over the social determinants of health and the major health needs that I believe are important to our community. Of course, I do think moving forward, we definitely need to ensure that we're hearing from our community members, because that is the only way that we can truly know what the needs are for our community members. So whether it be through community health assessments, having them sit at the table when we're making decisions, that is the best way to know what's truly needed within our communities. And I think that's it for now.
Wow, thank you so much, Dr. Samuels, for that. Just some powerful information in regards to the social determinants of health and health disparities. She spoke about the issue of poverty. She talked about the economical state of our people. She touched on the policies that also shape and affect us. Now, Dr. Staples, you had touched on the point of COVID-19, and one of the questions that came in is, and I'll direct this to you and Dr. Holder, can the pandemic, could you please shed some light as it relates to how the COVID-19 pandemic has exposed the inequities in our nation health system? So let me repeat that question for you. Can you speak to how the COVID-19 pandemic has exposed the inequities in our nation's health system?
Right. So if it's okay, I'll go ahead and start off. So in terms of, again, this is a perfect example of the social determinants of health and how, African Americans in general are at a disadvantage when it comes to many of the factors that I discussed earlier. So, one of the things I mentioned previously during my discussion is that paid sick leave, for instance, was something that was not quite discussed prior to COVID-19, but is something that's so important. And, this pandemic has shed light on the importance of paid sick leave. And the fact that many of our community members are the ones that are in the service industry, we're the ones that on the front line, we're the ones that are being, greatly exposed by COVID-19, yet we're the ones that lack access to paid sick leave. So God forbid you become infected with COVID-19, not only are you putting others at risk, but you're unable to, perhaps take the time off that's necessary to recover from COVID-19, because now you're left with the decision of, do I go to work and possibly infect others, or do I forego income and stay home and recover and ensure that I'm not infecting others? So I think in that aspect, COVID-19 has definitely shed some light on issues that have been around. It's been long-standing issues, but they haven't been spoken about quite enough. In terms of other factors that have been exposed, in terms, when you think about COVID-19 and the health conditions, underlying health conditions that our population tends to deal with, we've definitely seen how an increased prevalence in things like asthma, diabetes, chronic conditions has led to our population experiencing more severe illness when it comes to COVID-19. So that, that is something that has been long-standing. It's been something that, we've always known, but seeing COVID-19 and seeing the effects because of those underlying comorbidities or chronic conditions, we're able to see that, or communities are being greatly affected because or underlying health status isn't quite where it should be compared to our white counterparts. So those are the two major topics that I find to be that COVID-19 has definitely shed some light on. And I'll allow Dr. Holder to go. I don't want to take up all the time.
I forgot to unmute. All right. Now, we just looked at the slides I showed, and if you had a point to note the date from 2000 on, Black folks, Afro-Caribbean, and the African Americans have higher rates of diabetes, high blood pressure, obesity, all these problems, which came, as you understand now, from the weatherization, the stress, the way we live, the way we work. So when this infection came on, it found in medicine, we say about the host, the body that you inhabit. This body was already not 100% because of all the other problems. Then this virus is unique in that it attaches itself to cells that have ways that have shown inflammation. So obesity has inflammation, diabetes has some inflammation, and that attachment then, and also vitamin D deficiency, which is not talked about enough. But vitamin D deficiency, which we see from being Black and not being able to keep the resource well in our bodies because we need more sun, very complicated process. But in the essence, this virus found a body that had all the limitations that made it grow stronger and much more severe. So it accelerated what was happening to us from the beginning. It accelerated the death. It accelerated and impacted the poorest communities who would go out there and see this virus, get infected, have a body that's already been weatherized and slowly dying, because we know our death rates are much higher for Blacks, for diabetes, for everything. Life expectancy is shorter because of all these problems. And then the virus attacks bodies for those vulnerabilities. So of course, it's not a surprise again that this population would be impacted more significantly. And I know Miami Gardens, I've heard from many of my patients who have suffered and have relatives who passed. My family, the same, we've had relatives that have passed on the coronavirus. And so it has exposed the same inequities that we've been talking about, because it exposed the poverty, it exposed the lack of access to health insurance, it exposed not having any, like you said, sick days. Even to this day, we're trying to test populations, and the same populations out there working don't want to get tested because if they're asymptomatic and they show up positive, they can't work. If they don't work, they don't get paid. So now we're having people pulling back from testing because they don't want to expose it. So it has brought to light the same problems we've been fighting for decades. And it's just accelerated the death, and it all is preventable. Again, prevention is better than the treatment. And that's where we really have to push ourselves in this community to speak up and protect ourselves in our homes. Masking, a policy that would have protected poor people who have to work, was not implemented. A policy that would have protected our vulnerable population was not implemented. So when they got sick, they would die because their bodies weren't as strong to start. Well, the other population got sick who were more richer, who were more healthy. When they got sick, they didn't die. So this is where, again, we look at policies and the importance of policies, the importance of understanding your communities and getting the changes that we need, like expanding Medicaid, getting sick days, even maternity leave, something as simple as getting some paid maternity leave we don't have. And one thing the coronavirus showed us is that during this shutdown, we had less premature babies. So something happened by putting our pregnant moms at rest, decreasing our pollution, had less premature babies. So we know that we need some maternity leave so these moms can stay home and rest. We need sick leave, we need health insurance, and we need better foods, we need access to exercise. And coronavirus, again, has demonstrated that when you don't have these, it is not about skin color. All our skin color does is maybe the vitamin D. But beyond that, there's no race. We're all the same. but how the races that we call races live in our societies and what resources they have and what policies work against them, that's what then drives our disparities. And coronavirus demonstrated that again, just like HIV/AIDS demonstrated that. We now have another pandemic to show the same information. So what are we going to do differently this time? And that's what we want Miami Gardens and PenTab to think about and say, what are we going to do differently when we've learned this lesson?
Beautiful. Thank you so much, ladies. And we could talk here forever. I have some questions for you that I'm not even able to pose, but this conversation will continue. And we talk about the Live Healthy Miami platform. There are so many opportunities for us to, as a people, learn more about preventative care. I talk about FIU and the mobile unit that comes to PenTab every Tuesday. The mammogram unit that comes every month. I mean, these are perfect opportunities for us as people to just capitalize on, grab the opportunity for the services that are out there. But before we go, I want to pose this question to the oncology students. And it goes something like this from one of our viewers. How has the pandemic suppress preventative screens such as cancer screens? Do you think that this pandemic has suppressed preventative screening such as cancer screens? And any of the oncology students can take this question. Thank you.
I can start us off. So at our last oncology meeting, we talked about a paper that came out recently during COVID, basically saying that people were reluctant to go see their physicians to follow up with treatment, which isn't surprising. And, you know, COVID has brought to light that we can do some of our physician visits online, and some of them aren't necessary to go to the office. But the paper basically said in summary, you know, going to the doctor for cancer screenings and for preventative treatment is the #1 thing you can do. And while you might be deterred due to the pandemic and the fear of contracting COVID, these institutions are typically built in a way that at a time like this is insulated from the pandemic. And so it's vital to go to your physician, and it's vital to reach out early. And again, I'm going to emphasize prevention is better than treatment. You know, go to that physician even if you're nervous about getting COVID, because if you take the right precautions, the risks are less than the benefits.
Just to add to what Sky mentioned, we had a meeting with a physician who is a radiologist, and she did mention that her workload has decreased significantly. And so, for example, women who are getting mammograms, the numbers are a lot less, and the repercussions we'll see in a few years, she mentioned. But in the future, she was certain changes would be seen in the rates of diagnoses.
And part of this also relates back to what we presented about the importance of understanding your risk for certain diseases or the chances of you developing cancer. So take into account your family history. If you have any immediate relatives who have had it before, it can increase the urgency or the importance of you having to go and get a screening done. Especially right now, even with the concern of the risk of contracting COVID, the longer that you wait, the higher the likelihood that the disease may progress, if left untreated or unchecked. So it is important to still try to find a way to make time to get your screenings done when you can.
Great. Thank you all so much for this just wonderful information that has been presented to us. I know the schedule of our presenters. I know how busy you are, and we really do appreciate the time you have taken to come and speak to us. And if I might not sound too ambitious, I would really love to see a continuation of this conversation sometime, because we need to talk about this in our circle. We need to talk about this among our people, but we are mindful of the time. We're approaching 11 o'clock when our next presentation will be starting on ergonomics. So you do not want to tune out just yet, all our viewers. You do not want to tune out. We will be talking about ergonomics with Dr. Mora. Thank you so much, Dr. Holder, Dr. Samuel Staples, the oncology student. We value the information. This will be on YouTube, everyone. We can rewatch it. We can learn, and trust that we will be continuing this conversation and making changes. One phrase that came out throughout the presentations, and that is treatment. Treatment is better than prevention is better than treatment. Sorry about that. We're so used to prevention is better than cure, but I love it. Prevention, treatment is better than prevention. And that would be the tagline for our discussion this morning. Thank you all again so much. Definitely. Thank you all so much for being a part of this session, and do hope to see you in the next 3 minutes as we hear from Dr. Mora. Yes, we are off. Thank you all so much again. Really, I don't think the time was enough for this. Thank you so much, Dr. Holder, Dr. Samuel Staples, everybody. And we will dark. Uh-huh. I couldn't hear you, Nicholas. I'm so sorry. I'm so sorry, my dear. I didn't hear you.
physician. So I just want to go over some things that are important when we are working in a certain job. So I didn't create this PowerPoint presentation. This was created by OT Resources Working Group. I used the PowerPoint presentation. I modified some of the slides and I'm presenting it. Okay, so when we talk about what people think about what is ergonomics, and because it's something to do with our job, and when we see the definition fitting the job to the worker, it means like rather than the worker fitting into the job, we have to do the other way around. Before you used to say, okay, so you come here to work and you are going to have to do your job no matter what it is. But right now, because of the injuries and that kind of stuff, so people start thinking maybe we can change the way we work in order to do a better job, and the worker is not going to get so much injured. And so that includes a lot of things, includes our workstations, tools, equipment, and I'm going to be talking about some of the injuries that we have when we're working. The number one is overexertion and bodily reaction. And for anyone who has been doing any kind of job, because this applies to everything, that relates to everyone. And so that's why we need to start addressing the issues that has to relate to our job in order to do better job and don't get injured. So if you see here, most of the things are overexertion and bodily reaction. And the other one, the second one, is falls, slips, and trips. When you see what kind of industries are having issues, and you see transportation, warehousing, yes, this is the number one. And people who do this kind of job, they're going to have bigger issues because of the kind of work we're doing. We have, of course, anywhere you can have some issues, but this is the number one. So when we talk about ergonomics, the number one thing that we start considering is the musculoskeletal disorders, because this is what is affected the most. And so what presentation one can have, I mean, you can have, because of the job you're doing, you can affect your muscles, your nerves, your blood vessels, ligaments, and tendons. So the symptoms that one is going to present are completely related to these things. So, and I see it all the time with people coming from discomfort, some pain, some numbness, some issues with motion, flexibility, stiff joints, burning, swelling, tingling, inflammation. And this is a common presentation of work-related disorders. How they present, and we see it all the time, carpal tunnel syndrome. People start having issues with the wrist, and they start feeling the hands numb, and they say, you know, I've been having this for a long time. I don't know what it is. My hands feel numb, usually when I go at night. Tennis elbow, which is just issue related with the elbow, with the outside part. Bursitis is inflammation in kind of joint. Ischemia, because it depends if you are working with cold issues, you may have some issues related to that. The curved veins is another kind of tendinitis. Sciatica, people complain a lot of these things. As they say, oh, my back is hurting. I have herniated disc. A big one is neck issues, and this is one of the things that I think I see the most. Tendinitis in general is very close to bursitis, but it's kind of in the same kind of presentation when the patients come. A rotator cuff. Rotator cuff is mostly, we talk about elbow, shoulders, and that's when people start having that. Neuritis is inflammation of the nerves, and so on. So we have many clinical presentations that some of you may have. So just be mindful. It can be related to the type of job you're doing. And so what can we do in order to reduce these things? Ergonomics is not something new. Ergonomics has been for many, many years. The issue is sometimes when we are working in some place, we don't have really our like occupational health unit who is checking if we are doing our job in the right way, or if we are doing interventions in order to reduce injuries. So at the end, we are going to have some time for questions, so we can address some of these issues. So what things, for example, can give us injuries? work position and postures. And for you guys that have been working right now from home, you have been in front of a computer all the time. And if the computer, like in my case, is positioned a little bit low, it may give you some neck pain. How often the task is performed, it's not the same things like you do a task, like for example, cutting things every week when you have a job where you have to cut something every single day of 8 hours a day. And the level of required effort and duration of the task. So these are the things, issues. And I'm going to give you some examples. You can see the pictures there, and also solutions that I think they're important. For example, these, we see all the time this. This is not new. You see people working, you pass by and people are working above the head. And that's a hazard. I mean, you should not do it for more than 2 hours a day. So if you are doing this kind of work for any reason like that, you may have some issues related with your shoulders or your neck. And you may not be aware of that. So working with elbows above shoulders for more than 2 hours a day, so we can change some things. And I see here the position of the gentleman trying to grab things is really high. No, it doesn't have to do really low, high. So it has to be, you have no more than 2 hours a day, because it's gonna give you some issues with the shoulder. So how we can create solutions. So you saw these things, the gentleman grabbing here, so you cannot do it for more than 2 hours a day. So here it goes. So you can put something there, so rather than to be high, so you can be straight. And that's kind of the normal position for the shoulder. So whenever you are up, you are putting stress in that joint, and that's gonna give you pain. And here's another example, someone working in another factory and carrying some weight. And so you can see the position of the arm, and this is like kind of a 90 degrees, so that should be okay. And also, for example, this person grabbing these things from here, he uses something here, staircase a little bit, so you can get to a higher level, so you reduce the risk of injury. You can use some things, like for example here, to grab things from above, so in order to reduce that, and also using some devices. So like here in the third picture, someone is carrying things, so you don't have to do that. So it is one of the things that we can do in order to control. Remember, all the joints, when we are doing things, that can be impacted. If you do a lot, you're going to have issues. If you do it just one time, you don't have an issue, but just be mindful about that. And also depends how fit you are in terms of, are you doing this? Are you doing some kind of exercise? If the people who don't do exercise, they tend to get injured more frequently because some of these muscles has been used. So just be mindful about as well these things. Another hazard, and I mentioned here because right now I'm with my computer, and I think I have more than 30 degrees, maybe the inclination when you have forward. The 30 degrees is kind of the issue. You have more than 30 degrees, you start having issues with your neck. And so may not bother you when you work once a week, and if you have to do your computer once a week, but when you start doing that often and people start complaining, okay, I start having neck pain, or I start having blurry vision because you have something that we call myofascial pain, which is has to do with the muscles and the tendons. And so just be mindful about that. So the inclination 30 degrees is kind of the standard. When you start going more than that, you start having issues with that. So like, for example, the person here carrying some things in the garden is going to have issues because of the bending here. So, and it's quite more than 2 hours a day. Everyone sees this. I mean, so you see working, this is really uncomfortable position. Maybe you can do it for 5 minutes, 10 minutes, but when you start putting more time, you start having more issues with that. So, and also kneeling more than 2 hours a day. So we see it's okay to be kneeling sometimes. And even when you do it one time, I mean, it happens to me. If I kneel for a little bit, I start having knee pain. So just be mindful. These are the things that should not be happening. So what solutions we have? And this is really good here. Something to raise our load so we don't have to bend. That's kind of the smart way. We have the lifts here. You can see here as well in the second picture. So you can lift things and also here, instead of bending, you move all the heavy things closer to the person. So these are things, solutions that we can have in order to reduce injury. But remember, as I say, not everyone has an area where you work where you're going to have occupational health department. And so it's part of the process of you learning that this is part of the accommodations that we need to have in a certain job in order to reduce injury. So if you see something that right now it says, wow, maybe we can use from a job, rather than to go and confront, let's say, why don't we get these things in order to improve the conditions of the people working here to reduce injury. So it says here, for example, use tools with longer handles, yes, to check, for example, on the floor or carrying these things. So you can see here the yellow thing in the middle picture, and also you alternate between bending, kneeling, sitting, and squatting. So you can see even the leg here, and you do it in order to improve. Another thing that I want to mention here is the ergonomic control for grips. Grips are very important, and sometimes we don't pay attention to that, but it really can produce like what we call trigger fingers. It's like when you put the hand and it gets stuck and you cannot move it because you have an inflammation here in some of the tendons, and so gripping more than 10 pounds of force for 2 or more hours a day. So that's an issue. So if you're doing working construction and you have to grab something like this for many hours, yes, it's going to give you an issue. Even something that's more thin, but you have to do it all the time. Or even here when you're baking or doing things, just think about what you do, like how it can impact that. Hazards we see here, again, this is for your fingers. That's going to give you an issue. And that's the issue. It's become chronic and maybe more difficult to treat. So what the solutions? Design work layouts to reduce hand carrying. So just be mindful about that. These can be these things. You can use, for example, special gloves. They can reduce these things. And I have here some tools, for example, how to change from some of the knives or the C-shaped postures in order to grab things. So just be mindful that these things can be done, and you just need to know where to find. So, but this is part of, and remember, some of the, if someone is more interested, I have here at the bottom of the slide, it says OSHA. OSHA is the organization that has to do with these things. So you can go and put OSHA on any Google, and you're gonna find that, okay? So another big thing that we have is repetitive motions. And this is one of the things, and you see it when people are doing every single day the same thing. And that's going to give you, whatever you are doing the repetition, you're going to have the injury. For example, a cyclist, you are a professional cyclist, you're going to have repetitive motion. Your knee is going to be moving all the time. So you are more likely to have knee issues just because of the nature. No matter who you are, you can be the best cyclist in the world, but if you're going to be doing, the body has to have balance between recovery time and injury. And if you are doing every single day, and this is one of the most common complaints I see in my practice, is people come in and says, oh, I have hand pain, or I have shoulder pain, and you start asking what kind of work you do. Oh, I carry things all day long. So of course, it's what to expect, and that people are going to have these things, okay? And you're familiar with this. This is the more repetitive motion that we see is the computer. People all the time, and my child has to attend online classes. He's 6 and he spends 12 hours, 8 hours a day in the front of the computer. He's 6 hours in the morning, then he has homework. And by the time of the day, he's tired and he says he's just exhausted. So just think about if you're doing this every single day. So you're gonna have issues that, and the most important right now is to use the cell phone. Using the keyboards all the time, that's a repetitive motion. So just be mindful that can be also. So the solutions, arrange work to avoid unnecessary motions, let power tools in case you can use the work, and spread repetitive work throughout the day. It's easier to say than done, because if you're doing this job all day, it's really difficult to say, oh, I'm going to take a break. But just take stretch pauses. This is one of the things that you can be doing in order to improve. Go for a walk. In some places, I mean, they don't question if you go to the bathroom. So maybe going 5 times to the bathroom during the morning, you just walk a little bit and you start having that. And so you can see how you can have the area of distribution where you do the primary work zone, and then you start, in order not to move so much, in order to have these issues. Another thing, the big one also is the pressure part. I want you to see this picture, because this is when you use the keyboard. If the keyboard is not appropriate setup, so you're going to put pressure here. And so you may say, but I don't work much in the computer. Yes, but you're putting pressure here. And we have some important tendons and nerves here. So you may go home and you start complaining at night for some pain. Or standing or kneeling for prolonged periods of time. It's just for someone to just start sitting all the time, all day. So you go home and you start feeling like you have back pain or pain on your hips because you have been sitting all the time. So it's a hazard. This is very familiar when people start using the hands to hammer. Remember, that's bad. And for people, for example, installing carpets or floors, they have to spend all time. This is a hazard, so that we know that. So the solution, like for example, you're going to be standing, maybe you can use a different kind of chair. I always wonder when I go to the grocery store and I see the cashier standing all day, and I say, why they cannot provide a chair like this? At least they can have some support, because they're going to have issues. And you can see some of the cashiers, they have, if you pay attention, they sometimes they have issues with the wrist. That's why you're using some wrist guards, that kind of stuff. So you can use tools that better fit you. When they're more thick here, you're going to reduce the stress that you have in your hands. And also tools that you can put a little bit longer. I usually vacuum during the weekend, the home, and my vacuum has this tube is a little bit short, so I have to bend a little bit, and that just give me back pain. So I just cannot imagine if I have to do that every single day. I definitely will have a lot of pain. So just be mindful about that. Just one time, it can give you pain. What other things can we do? I don't know if you have seen these mats. These mats, you stand up and it feels a little bit cushioned. That's another thing that can help. Also moving the station so you can be maybe not putting pressure in the area and cushion this part. And you have seen these keyboards where you have a little bit, this is soft as a cushion, and also having the knee protectors if you're going to be a lot on your knees. Big one, and I think one of the biggest ones is lifting things. And people always think they can lift things heavier than they really can. And this brings main issue is the back pain. Okay, so you have to do it all day if you work carrying, or if you're at home. Just be mindful about that. This is the wrong thing to do, because you're bending your back here and you're going to have issues here. So here, more than 30 degrees, and you're carrying something far from your body. When you're carrying that, you put more stress in your back, or lifting things above your head. So just be mindful about that. And again, it depends who you are. If you are you are been training, weightlifting, and you're really strong, you may be able to do more. But if you are not, remember, you don't have maybe really good muscles in your belly and really good muscles in your back, so you're going to put a lot of stress here in your back. So we know these things. We have seen that carrying things, and people say, look, this is wrong. This is having 90-degree back. As I no, you're going to have pain. It's like, and this is why people tell you when they come and say, oh, I tried to lift something and I have my back pain, or I was cleaning my house during the weekend and I have these issues here. So there's solutions every time we have something that can raise these things and carry things high, so you don't have to really bend in order to do that. Just think about your back, because this is kind of the most common concerns, and most people complain of back pain. Lifting, don't do it by yourself. Bend your knees is one of the things. Carry things. I use the proper technique, and closer to your body, no far from your body, closer to your body, because that's the way of torque is going to reduce your back pain. So you have seen this. This is a correct technique. Keep the load close to your body. Here you see this gentleman carrying these things. If you put your arms straight and you're carrying the weight, it's going to put more torque in your back. It's going to put more pressure on your back, and you're going to have more issues. So it's close to you, as close as you think it is for your body. Bend your knees and straight your back. So you see your back is going to be straight. So when you put the pressure here, it's going to be uniform. When you bend, it is not, and it can give you back pain. Also, lifting techniques. You see the gentleman here put the weight onto your knees, basically that, and start moving one leg, putting their neck here, and then they stand up, never bend their back. And that's one of the things. And you can see he's using as well eye protector here. Remember the helmet if you have some objects, the eye things that you can have protection. Vibration, if you are exposed, if you are in landscaping, you're going to be exposed to a lot of vibration. And vibration is one of the things that in the long term, yes, it can give you issues with carpal tunnel syndrome, or it can give you numbness in your hands or tendinitis. So just be mindful that even if you are not using your hands, but you are in a car like this, and you can have vibration, and vibration can be exposed and can give you these things. So solutions, we have some tools that can reduce vibration using special gloves as well, we call PPE. So they can reduce that, and you can, but you're gonna have to rest in order to reduce this or alternate that. So we didn't wanna make it that long in the presentation because I want, if you have questions. So remember, employer has some obligations, and you can go and see OSHA. The employee should furnish to each of the employees employment place of his employees. They should give all those things, right, to reduce the cost of physical harms, and they should comply what we call OSHA, is Occupational Safety and Health Standards. Okay, so you know that you are. This has to be part of mandatory that. So, and you should comply with these things. So, but one of the things is, rather than, because I see a lot of people working and it says, oh, but you know, can you give me a letter saying that I should have a different kind of desk, or can you give me a letter so I can take some breaks? Yes, your primary care doctor can give you a letter. Like, for example, if you're working all day in a computer, and from the computer it says that you should take some time just to rest or to do some other activity. Just be mindful. Is trying. I don't know what kind of work you're doing, but just be mindful that if you do it really long, you may have some more injuries. And by finishing, I'm gonna finish because this is the big one: back pain. Back pain, it really affects a lot of people. So yes, what is your risk? If you carry heavy objects, if I'm overweight, and as I mentioned, that not all the people get sick with the same conditions, even doing the same thing. It depends the kind of work, the intensity you are doing, and also it depends on the individual. If you have to stand or sit for more than 30 minutes, if you put your phone over here to talk, you're going to have that. If you sleep in a mattress that's too hard, if you wear really high heel shoes or perform task activities that require frequent bending, I reach for items above my shoulders, I carry or lift children, I lift heavy objects of the floor from the floor. So remember, causes of back pain, we have these things, and we already mentioned these things. This is not proper. Having the muscles, abdominal muscles, if they're not really strong, you're going to have back pain and high shoes. So avoid slouching or leaning forward. Sit upright, and proper posture give you support that you need. Okay, so I want to open for questions. Any questions? No, that's the presentation. Basically, that's my presentation. I wanted more to open for questions because this is ergonomics. Ergonomics is basically a science that is going to adapt the environment to the worker so the worker can have less injuries. And the idea is, I don't know some of the audience what kind of work they are doing, and if they know what how we can prevent injuries and we can really improve these things. As I mentioned, the use of the phone, the use of the phone is the big thing. People are using all the phone all the time and typing, and it's part of the job. But people say, but I just use it 2 hours a day. Yes, but that's gonna create issues with your thumbs, for example, with your wrist. You're gonna, and a lot of people come to the office and says, I've been having this pain, kind of numbness in my hands for a while. I don't know what's going on. I'm having issues with this. So just be mindful that may be repetitive. The keyboard is a big thing. The position, like I'm talking right now in the computer. As I see you, you have headphones and you can talk really well. That's a good thing. Most people just do this like this all the day, and they're going to have issues with that.
Information, and it's very valid information. And a while ago, I just reached out to our food bank team because we have a food bank that we operate every Tuesday. And a lot of what we do is lifting boxes, moving food, and moving items around. So I think it's very valuable to our audience and in general, particularly because we are stationed at our desk so frequently in regards to using the computer. Now, what are the implications, therefore, for children? I know they're young, and oftentimes we don't think that they may be affected in terms of just proper posture and the things that you have pointed out in proper use of the computer and use of the workstation. What are the implications for children? Are we going to see them now? Is there a long-term effect on their bodies?
I mean, the good thing about the body, it recovers pretty fast. The younger you are,
Right.
I'm also a geriatrician, so I see a lot of all the adults, and I see as you get older, as you grow older, you're gonna have less opportunity to recover from any kind of injury. Children are pretty resilient; they recover pretty fast. I see, and I can speak for the things you. I'm also a family physician, and I see younger kids,
Right.
but I don't see the kind of injuries that you see when you are older adults. Of course, if your job, for example, we see is repetitive, can be anything relates to your job. If your job is, for example, to play football, and you're gonna be playing football, and or you're gonna be or you're gonna play baseball, and you have to throw the ball 100 times a day because that's your job, and this is part of the exercise that you do. Or this is part of who you are playing in with the school, and of course you're going to have injuries related to that. And I'm saying if your job is for example working in a bike, and you have to move from one place to another and use your bike, your injuries are going to be probably related to the things that you do. Like, for example, your knees are going to hurt because you're going to be moving all the time. So as you mentioned, like, for example, you're working in the food bank. The food bank, you're going to carry a lot of stuff and heavy. And the people tend to give you a food bank, things are in can, and things are heavy. This is, and it becomes a repetitive motion. And so one of the things I said is how you putting the boxes maybe in the place, and also putting a limit on the weight that people can carry, rather than to carry a really big box. Maybe it says, hey guys, we're going to change it, and we're going to carry just half of the load every time we move. It may be twice as much work we have to do, but you're going to reduce the risk of injury. And you have to also consider how fit is the individual moving these boxes. If it's someone who is very young, strong, it's unlikely they're going to have a big injury. But if you, a lot of people don't do exercise, and you have weak muscles, but being exposed to that, it's just maybe one time or two times they're going to have the injury. And this is kind of like, unfortunately, when an injury happens, we tend to blame so often the person who's doing the job. But many times, the people who are doing the job, they haven't had any proper training in how to do the job better. As I mentioned, I mean, it's like I work in many places, and hardly has someone passing by and check if my desk is in the right position, or if I'm doing the keyboard in the right. No one has checked on that. So to just be mindful about that, that what is expected, I mean, in terms of like people checking and says, because I don't have any complaints, okay? If I have complaints, of course, someone will come and says, will come to my office and says, oh, you complain of neck pain and that kind of stuff, so we come and check. But I fortunately, I haven't been complaining about that. But just think about all the people who have issues and they don't want to complain because they may fear to lose their jobs. Okay, and I see it often. I say I have to work through pain because if I complain, I may be fired from my job. And so it is a fine line wherever you are, and how big is the company where you work for. There are really good companies. I mean, in general, you can see they provide tools for workers, but not all companies do. I can see another things that you may be exposed, and you see people, for example, cutting the grass, and you see it all the time. They should be wearing glasses and something to protect the ear because of the noise. And you hardly see that. You hardly see that. And so it's they may be provided for them, but they are not one to wear it. So just think about that. So that's being exposed to something and how we can improve the job conditions that we have. And certainly right now we have an epidemic of back pain for people working in front of the computer all day because of the COVID. So we were not used to do these things. And so we see problems. Can be a long-term issue. It can become chronic, yes. For example, lumbar pain, 10% maybe of the cases become chronic. And it may start because you are spending all day sitting, unfortunately.
Oh, very good, doctor. A question that really came to mind as you spoke, and a lot of what you're saying is grounded in the fact that we're not aware of the impact of the things that we're doing to our own bodies, and no one is there really to remind us because maybe they themselves, really do not know better. So we really appreciate you coming on and sharing this information with us. Is there a particular routine, and this may be an odd question, but is there a particular routine that you would recommend we use, especially if we're working from home? So in the mornings, we start our day at the computer desk, we end it at the computer desk. Is there a recommendation for what we can do in between that time to just, help our pains and aches? Because when we sleep at night, when it's time to get into the bed, that's when we start noticing the back aches and the pains. Are there anything that you would recommend in terms of mitigating that situation?
I mean, one has to move. I mean, that's and you're familiar with the statement that no moving is becoming as a smoking, as a risk factor as a smoking. And unfortunately, we spend all the time sitting and we don't take breaks for a walk. And just think about the musculoskeletal system. It means like when we talk about that, the muscles, the tendons, the joints, they feed and they kind of regenerate when you move. If you don't move, it's not going to happen. So you are most likely to have injuries. And I'm going to give you an example. The shoulder, it's a joint that is very commonly, we have as we get older, people start having a lot of problems with the shoulder. And it happens as well because as we get older, the muscles and tendons are not very in good shape. There are some changes related with aging. But as we get older, we also tend to move less these joints. You don't see a lot of people moving their arms or doing exercises with the upper body, like hand bicycle or doing the kind of stuff, or swimming. People tend to associate the exercise just by walking, and so they go for a walk, but they're using just the legs and they say, yes, I do exercise. Yeah, but we hardly do exercise from the upper body. So those muscles are very weak. So you go and you get a job and you have to carry things from somewhere place. Those muscles are very weak. So most likely you're going to get injured. Okay. So it goes that to thinking about it's not just the job you're doing, but how in good shape you are in terms of doing that job. So how we can knowing that there are things that we can improve our the way we do it to reduce injury. At home, you're sitting all day in front of the computer. There are some studies that have demonstrated, like, for example, if you do exercise, for example, you wake up, you do exercise in the morning, you stay all day seated, that kind of exercise was not that beneficial. It's going to improve some of your wellness and your health, but it's not the same, like for example, doing exercise in the morning, maybe 10 minutes, then in the middle of the morning, at noon, and in the afternoon. So it's those times during the day that creates a break and at the same time improve your health. And if you're sitting all day, you need to stretch. You need to stretch the upper body. You can go see online. You can see stretching your upper body when you're working. And part of the exercises are really, so you just stay there, just put your shoulders to the back, stretching against a wall for your back. But you have to stop 5 to 10 minutes, going for a walk, breathe, don't stay all in the position, because that's what is giving us trouble. The continuous doing the same thing and not improving. And also, if you're seated, remember is the height of the chair. It's okay, and you can see everywhere online. You can see what is the standard height for my chair, how far has to be seated against the back of the chair. If I need support from the back, or if I need to put a stool to put my leg and relax when I'm sitting. So all those things that come to mind what ergonomics. Ergonomics is how you can accommodate your job to make it better. Of course, we cannot have any description for all the jobs that everyone is doing, everyone who's watching this. But I just want remember OSHA, OSHA. So you put OSHA, and for example, you're gonna check back pain. And so then you start looking at information that tells you, oh, if you're doing this, you should do it these things. And so just think about it, because one of the things, like for example, you're at home, of course, you can be fancy and go and buy a desk that can move up and until you start working standing up. Yes, but if you don't have the money to buy the desk, at least you can maybe change it to a higher place in the house. So you stand up for a little bit. You're still working, but you change the position, okay? And also when you're standing up, remember, standing up, it's not the best position all the time. You need to be moving. If you move your legs when you're standing up, you're pumping some blood from the legs and also reduce the stress, for example, for the blood vessels there and for varicose veins. So it's about accommodating. I just give you a little bit of examples of things that one can do in order to improve. So you start thinking what kind of job I do and how I can reduce my risk of injury. If you put it basically in any way in the browser and you start looking better ways to spend my time in the computer, I'm sure you will find many and they can help you to reduce these issues.
Wonderful. Excellent. And thank you so much for that. I'm going to be sharing with you some questions that came into the chat. The first one, can you speak on standing desk or ball chair and if there is evidence of benefit of these?
Yeah, the ball chair, you see it all the time. And actually in the school when my child goes, they ask for the children to sit in a ball. The theory behind that is if you sit in a ball, you're going to have to use your muscles in order to have more stability. because just think about when you sit in a chair. You're not sitting in a chair, you're not putting any effort. All your muscles are not going to be trained. So by sitting in a ball, it seems like you improve a little. You are more cognizant of your posture, and that helps. And actually, you can see when you go to the gym, some of the exercises that you do with a ball is sitting in a ball to improve position and improve your posture. So in that sense, it can help. The standing desk, yeah, people are using it, but remember, just by standing is better than sitting. Right. But standing has also the issues. So remember, when you're standing, if you're standing with two legs on the floor, it may not be the best way. If you start standing or you start walking, it's even better, because that motion at 1 mile per hour, just think about, it's even better than just sitting, just being standing. And if you have to stand up, always relax one leg, so you have to put a little bit stool to have one leg a little bit better. But definitely, standing desk is better than being seated all day. That's for sure.
Great. Thank you for that, Doc. Do you have any tips for preventing Zoom fatigue?
Don't do Zoom. No, I know it's like, I mean, I feel for our students, they have to do all day Zoom, and just this is another thing, just being exposed to light, and this is they sell some filters that it can filter some of the blue light. The blue light sometimes it can the bright light, and that bright light can affect your sleep patterns, and the screens are very good for that. So they sell some filters that can really reduce the eye strain, and that's one of the things that we can do. But unfortunately, these days everything is by Zoom. We are doing this meeting via Zoom-like platform instead of me being there sharing with you guys and drinking a cafecito with you guys. So I have to be here in Zoom.
Right. And it is so interesting that that question of Zoom fatigue comes up, and that you would relate it also to the lighting that we use so much, and that it does impact sleep, because we're seeing that the correlation between sleep and anxiety and all of these are definitely linked back to the hours that we're spending in front of the screen. So we're mindful that screen time does have some impact on or overall health. Now, there's another question. We're coming down to the hour, and it's, Dr. Mora, do you recommend a standing desk at the workplace? So I know you were talking earlier about standing desk, but implementing it in the workplace setting, would you recommend that?
I mean, it has to be employee dependent. I think because some people may not want to do it because they have joint issues. If you have osteoarthritis, issues with your joints, and I ask you that you're going to be standing, that may not be the best way to do that. So it depends. But it's more to encourage people to be healthier and moving more. Of course, having the desk is one of the things that can help.
Great. And I hope that person had gotten the feedback that they were looking for, because absolutely it comes back down to the organization and the employee. Is this something that will work for you? We have learned so much this morning in regards to ergonomics, and even our understanding of ergonomics. We see that it's very widespread in terms of when we think about ergonomics. It's not just about lifting. We see even what I found very interesting in your presentation, the position of the wrist at the computer desk. Can you just explore that a little bit more for me? Because that's one of the things that really jumped out. We have our wrist at the desk throughout the day, and I'm like, wow, that's pretty interesting. What are the implications for that on our bodies?
Whatever, it's pressure points. If you do it for 10 minutes a day, it's not an issue. When you start having pressure points, no matter what it is, in this case of the wrist, you're going to be basically putting pressure here. And this area is very important. We have some tendons and we have some nerves going through here. And people are going to start complaining of numbness in their hand. And they start saying, wow, I have numbness in this part of my hand. Or unable to, and they say they go at night and they start feeling weird. So just think about that, because pressure points are not good. Even if the pressure is in the elbow, if you're doing a job that the pressure is in the elbow, we are not made to support pressure. And so that's one of the things that we have. So avoid pressure. We have some pads that you can use to relax your wrist and this kind of stuff. It depends. Some people don't need the pads because some people do not, but some people do. Some people type all day in the computer, 360 days a year, and you ask them, do you have any issues? Zero issues. How come? But there's some genetics as well, being lucky or it is, but there are some people who work 10 days out of the year and they have the problem. So be mindful. It's not just the job we're doing. It is we who, as we, I mean, it says as a person, we are being exposed to those things. I know, like, for example, I should not carry certain things because I know I'm going to have back pain. I mentioned when I vacuum, I have back pain. And I know it. It is something that I do that it triggers my back. So just be mindful about that. Everyone is different.
Wonderful. And it's important that we be self-aware, know, our own bodies. As you said, if you vacuum, then that's going to trigger back pain. So we have to be conscious of what our trigger points are. And it's so funny that when we think of our health and holistically, this seminar is about faith, your health, and overall wellness. It was just outstanding how we have seen that in connection between the physical, the mental, and of course the spiritual. And your presentation this morning has definitely demonstrated the implication for the things that we do, even in this COVID season, into our bodies. I've learned so much. And as you said, it's very rare that we hear conversation around ergonomics. So
Yeah, it is
it
like
was very insightful.